that imagine your WhatsApp. Everybody's on WhatsApp, right? So WhatsApp is actually the information, all the messages, those are the stem cells. And then the WhatsApp is like a vesicle to carry it. Those are the exosomes.
Exactly.
Amazing.
Exactly.
Hello everyone, this is Dr. Salma with Let's Talk Aesthetics. So I've been following exosomes for some time, and when we talk about exosomes, another company that comes to your mind is Biosciences, doing amazing work. And we're looking to have Dr. Maisa all the way from Dubai.
Yes.
And we're going to be talking all about Biosciences. Welcome.
Thank you so much, Doctor. It's a pleasure to be here and talk about this topic that I am passionate with.
Awesome. So what is Biosciences about? I mean, you guys have exosomes, and what is it about? Let's break it down.
Okay, bioscience actually it's a stem cells factory and DNA sequencing.
Okay.
So it starts with some DNA tests in Italy, but quick it spread around the world in Italy, but also US and in Dubai, Middle East in general. And we do manufacturing stem cells, either adipose derived or umbilical cord derived. And from these stem cells, we can extract the exosomes. So we can provide either some DNA tests that are very specific and something very unique, actually. We can discuss it later. But stem cells and exosomes also directly from the lab to the clinic.
Okay, so you're doing both stem cells and exosomes.
Yes, we do
Okay.
this.
So people usually have a misconception that they call it stem cells, exosomes, and exosomes stem cells. Break it down to what are stem cells and what are exosomes.
Yeah, it's very good question because, as you said, the people are mixing this information. So actually, exosomes, it's a very tiny vesicle. It's one vesicle between other ones that we have, that it's produced by the cell. Any cell actually can produce exosomes, any cell in our body. The difference between the exosomes from mesenchymal stem cells is the signal, because exosomes, imagine it as a package of full of informations, and those information has been delivered to other cell. So I like to compare with our WhatsApp. How we communicate through long distance each other, it's by WhatsApp.
Yeah.
So the stem cells produce this information, produce this message, and put on the WhatsApp of the cell, on the exosomes package, and send it to other cells. So since exosomes are the signal, they are just able to stimulate other cells. Of course, they do also some other functions, the same as stem cells, but the stem cells, it's very special. Why? Because they are the intelligence, they are the entire living being, and they have the capacity also to differentiate, to become other kind of cells. What exosomes is not able.
Oh, that breaks it down very simply, and now we can, if you can understand it now simply, that imagine your WhatsApp. Everybody's on WhatsApp, right? So WhatsApp is actually the information, all the messages, those are the stem cells. And then the WhatsApp is like a vesicle to carry it. Those are the exosomes.
Exactly.
Amazing.
Exactly. It's good.
All right. So with exosomes now, do they have to be a particular size to be effective?
Yes, actually, this microvesicle, it's called exosome because of them size. In a pool of vesicles that we call EV, extracellular vesicle, we have the tiny one that is exosome. But even to being very small, we have range of size. There are difference between them. And this difference, it's related with the source. So depending of which organ or which cell those exosomes has been produced, they will have different size. And it's also interesting because exosomes has been applied mostly for aesthetic purpose or hair falling. But we have much more applications
Many more uses.
for exosomes.
Absolutely.
And we can use for health conditions. We can, and since they are produced specifically, we can even using them specifically to trigger special cells in our body.
For example,
I can target some different health conditions.
Like, for example?
For example, we can extract, let's say, exosomes from the liver. So they carry information about the liver cells that cannot be delivered for other kind of cells, for the skin, for example. So since I know that, I can extract these exosomes from the liver cells in the lab, of course, because we are able to differentiate cells nowadays. And then I can do it IV to a patient who has a liver problem. And I can help the patient's cells to recover from that.
Oh, okay. That is amazing. So that kind of opens up a huge potential for reversing conditions.
Yes.
So now in terms of IV exosomes, so how do the IV exosomes work? Are they targeting only are there specific kind of exosomes that are targeting a special condition? Or IV is targeted to non-specific organs?
Okay, it's very good question as well, because the same way that stem cells has the capacity to homing, to go to the right place, exosomes do. Like the exosomes also does. So the exosomes, once you put it IV, it will identify what is the damaged tissue, and they will migrate based on the chemotaxis, based on signals from this damaged tissue, and they will be directly to there. Once they are in the damaged tissue, they are able to give those signals to whole cells. But there is one detail, that is these exosomes that are from mesenchymal stem cells. Because if it's from, let's say, blood exosomes, it's used to be in the blood, so it will do them job in the blood tissue.
Yeah, only there. It has to be mesenchymal tissue in order for it to be effective in the mesenchymal tissue.
Yes.
Awesome. That makes sense. Now, can exosomes attract stem cells towards them?
Yes, definitely. We can use exosomes in two ways. We can use them to prepare the ground for the stem cells, or we can use them for stimulate the stem cells. Everything depends of the target, of which health condition you want to treat. Because in the same way that stem cells does immunosuppression, immunomodulation, regeneration, and also anti-fibrosis effects, exosomes are able, but in different pathways, and also just exosomes will depend from the cell to do the job. So let's say I have a health patient, and this patient is having a severe inflammation. Not necessarily I need to apply stem cells, but I can start with exosomes, since exosomes are a quicker response to the inflammatory process.
And is this a little bit difficult to manage stem cells, and are they very temperature sensitive?
Yeah.
So, I mean, to keep the stem cells viable is a lot more challenging compared to exosomes. They're more stronger, I guess, in one sense. So the biosciences exosomes, do they have to be temperature controlled? Are they coming as a powder, in a liquid form? How do they come?
It comes as a frozen. Okay. And the standard control for any biologic product, it's -80. So if you want to keep any biological product in the very stable condition and viable to use later, it needs to be keeping in -80. When I promote any variable temperature, I am exposing my product, either cells or exosomes, to the degradation. And what is most important to breaking down here as well is that they are living beings, so they are alive. How can I transform a live cell in a powder.
Right.
It's very difficult because if you remove all the water from a cell, it's died. So there's still some misunderstanding on this topic.
Okay. So there's another patients usually ask me a question. Can exosomes cause cancer or or if there's a cancer, can grow cancer?
It's very common question.
Yes.
And it's the most concerning. We need to know that the cancer is it's extensive process. Cancer doesn't appear overnight. It takes between 5 to 20 years to appear. Okay. But let's say this person is in this period and they don't know, they were not diagnosed. And then they have stem cells or exosomes. Exosomes are not able to stimulate the cancer cell when they are allogenic, when they come from somebody else. If I'm using my own cells or my own exosomes, I am amplifying the same signal. So if I have any cancer cell, I'm just giving more from the same to my body. So it's very, very safe. There are controversies on this topic because some studies showing that they can even prevent or help to cure cancer. But we avoid any active cancer patient just for prevention.
Okay, all right, that's good to know. So there's so many different kind of exosomes in the market. So as a patient, what should they be looking for when they are trying to get an exosome treatment?
Actually,
how do they pick the best ones?
Yes, actually, the patient normally is not aware about the types, but the doctor needs to be aware. So the best one is the one who is able to deliver you the right signals.
Okay.
So if I'm using exosomes from other organisms, let's say from bacteria or from plants or from other source, that there is no relation with the human body, I cannot deliver the right signal. Because as much as specific you can be, it's better. So I have, for example, exosomes from the adipose tissue that are adult stem cells, and I have from umbilical cord that are birth tissue stem cells. So how can I compare? The adult, it's already specialized and they are good for some reasons.
Right.
But the umbilical has more potential regenerative capacity.
Yeah.
So depends of the target, but to put only one, I advise to go with umbilical cord because it's the most safe that we have, and also because it has more capacity for regeneration.
Awesome. Well, thank you so much for breaking down.
Thank you so much.
So now biosciences has, what is this different billions? Like patients are always saying how many billion cells we have in exosome. Does it make a difference?
Actually, the quality make more difference than the quantity.
Count. Okay.
But yes, sometimes it can make a difference when we are talking, for example, about the size of the area. Normally, we count either exosomes or stem cells based in the size of the area. So
area being treated.
Yes.
Okay.
So if I am going to do micro injections on the skin and they will be confined in the place that I put them, so I don't need to go with large
cell count.
Exactly. But if I am using, for example, for knee, for osteoarthritis, it's a very big joint, so I need more quantity. So I need like around 25 billions or 40 billions. It will depend of the protocol, but then I need to increase the quantity gradually.
What do you mean gradually?
I mean, if I will use, for example, for some regeneration in a small scar, I can apply less quantity. But if it's a very large scar, I need to apply more quantity.
Are you also talking about like adding multiple sessions?
Yes, also multiple. Exosomes, it's stay in the body for 1 month. So it is delivering signals to your body during this time. After that, it's gone.
Yeah.
So if I want to stimulate the body again, I need to do 1 more session. And also, as any kind of procedure in aesthetic, for example, we need more than one session, even
Right.
Botox.
Yeah, even Botox, right.
So exosomes is not different because it's a treatment. It needs time to work.
Right.
Sometimes one session is enough, but mostly the time for aesthetic purpose, I need more than one session.
Like a journey, like around 3 sessions, 4 sessions, something like that?
Yeah, it's at least 3 sessions.
At least three sessions. About a month apart.
I prefer to keep the applications in less time, like in the small gap.
Okay.
2 weeks apart.
2 weeks apart.
And the reason is because since exosomes act in the inflammation and the curve of the inflammatory process, it's reduced drastically after 15 days.
Yes.
I need to approach this first 15 days.
15 days. Keep the process going so you have maximum effect.
Exactly.
Awesome. So with the IV nutrition therapies, I mean IV exosome therapy now, what kind of cell count are you suggesting? Because obviously it's a really large area now you're addressing.
Yes, exactly.
Yeah.
When we are doing exosomes IV, normally the standard it's 108 billions.
Okay.
But when it comes to stem cells, then we need to calculate based on the weight.
Okay.
1 to 2 millions stem cells per kg around.
Okay, 1 to 2 billion stem cells.
The stem cells are counting in millions.
Millions. Okay.
And the exosomes in
Billions.
Yes. Exactly.
So for IV, it is usually about 108 billions for exosomes.
Yes.
If you're doing stem cells, then it is about 100 million per kilo.
It's 1 million
1 million.
kilo.
1 million per
kg,
kg.
yeah.
Per kg. That's how
So
you get.
it will be around like 8 millions or 100 millions. So in bioscience, we standard in 2 options, 100 million or 200 millions.
Okay.
And sometimes the people think that if they do 200 millions, it will be better.
Yeah.
But actually, the studies shown that between 100 and 200, there is no much difference.
Okay.
So I prefer to do 2 sessions of 100
You're
than
right.
1 session.
Instead of just going all together at once, 200, break it apart.
Even because when you go to the doctor and they give any medication, they don't ask you to get all
At
at
once.
They give
It's
to
just a
you
process.
a protocol. Yes, the stem cells are the same.
Yes, very well said. Well, thank you so much for, kind of breaking up all of these misconceptions we had about exosomes and bringing the amazing high quality biosciences to Pakistan. And we can't wait to see what's next.
Thank you so much.
All right,
Thank you so
thank you.
much
Thank
for
you for
your
your time.
time. It was
Thank you.
a pleasure to be here.
Thank you.
And to breaking down those informations about exosomes and stem cells.
Awesome. Thank you.